Hi, I'm Dr. Burnham, and today I wanted you to meet my patient Ron. And Ron came in because he had some pretty severe low back pain. And Ron, can you tell us what happened with your low back?
I was working one Saturday in my garage, and it was kind of rainy out there and cold, and I caught a chill in my back. I have arthritis in my back, and it really set in. And over a couple of days it got worse, so I went to the doctor, and the doctor prescribed inflammatory medicine, and nothing for pain. So I went home, and it progressed, and I mean it just radiated and started dropping down even lower in my back, and I ended up going to the emergency. And the doctor at the emergencies, they couldn't find anything really wrong with my back except, he said, well, because of the pain. He said, well, what level of pain are you in? I said, at times I'm at maybe about an 8, but if I turn the wrong direction, I could go to maybe a 15, where it really hurts. So they gave me vicodin, and all the vicodin was screwed up my head and it screwed up my stomach, and it really didn't do much for me.
Right.
And then I remember Dr. Paul, so because I haven't seen you in over 10 years.
Yeah, it's been a while.
Yeah, so I came in, and in about 15-20 minutes, you did more for me than what the doctors did in those 3 days.
Awesome, awesome. So, basically, as we look at you today, how's your back been feeling?
Oh, heck of a lot better.
Okay.
Oh, yeah.
And
I'm a little bit stiff, but I realize it takes a little bit of time to work it all out.
Right.
And miracles, it took a while to get worse. And then the key here is that I've learned is that when you start feeling this coming down, the sooner you can get in, the faster you're going to get results on this.
And the cool thing here is that you've been in before, and so it wasn't very difficult to adjust you. But what I impress upon people is the fact that to maintain your spine and keep it healthy and avoid situations. But if you come across a serious problem like that, and where you rush to emergency, the first thing you want to do is just make sure your spine's unlocked and not taking pain pills or anti-inflammatories. And half the time they don't do anything for you anyways, and you're just getting a lot of chemicals in there.
All they do, they mask the pain,
exactly.
And nothing's getting done. And I find that I see people that feel real good. They bend over to pick up a pen, and their back goes out on them. And they'll go to the doctor, and the doctor will give them bed rest and medicine for a month or so, and it doesn't take care of the problem.
That's not the solution, but anyways, that's good for our listeners to see that, and I appreciate you coming in, Ron, and sharing your story.
Okay, great.
Thanks a lot.
You want?